Pentagon leaders say military recruitment is down 23% so far this year from their annual target. During a budget hearing in April, leaders already said 2022 has been the most challenging year to attract new service members since the military became all volunteer in 1973. Of the nearly 32 million Americans who are 17 to 24 years old, just over 9 million meet the physical requirements to join. Of them, just under half, 4.4 million, meet academic standards, and a little more than 10% of them say they want to serve. And now, tens of thousands of men and women serving our country could soon be discharged after missing the deadline to get a COVID vaccine. Members of the National Guard and Army Reserve had until June 30th to get the shot. Both the Guard and Reserve say at least 11% of their members remain unvaccinated. But is the vaccine really still that critical? Now, I'm a huge advocate of being vaccinated and boosted. But while getting vaccinated can help you, me, avoid being hospitalized, it can save your life. But the evidence that it makes you less likely to transmit the newer Omicron variant to others is slight. So, is it really worth losing thousands over their refusal to be vaccinated? When a restaurant these days asks me for proof of vaccination, I don't quite get it anymore. I certainly don't feel any safer. Early on, getting vaccinated meant likely avoiding COVID altogether, and therefore it made perfect sense to require vaccinations. But now being vaccinated doesn't prevent you from getting COVID. I was vaxxed and boosted. I got it. I'm not an exception. So-called breakthrough cases are so common that they really aren't breaking through anymore. Secretary of Defense Lloyd Austin says the mandate is for the safety of all members. According to a new study in the New England Journal of Medicine, even among patients who've received a booster, it was less than 60% effective compared to more than 88% effective against the Delta variant. And most importantly, the newer forms of Omicron are far more resistant to the vaccine, with effectiveness well below 50%. So sure, I wish all members of the military would get vaccinated. But I'm not willing to lose 11% of them over it. Joining me now is Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security. Doctor, thank you very much for coming on the program. Appreciate it. All right, do you think I'm getting something wrong here?
Not in broad strokes. I think the issue is one of force protection, and that the military requires many vaccines, some that are much less effective than the COVID-19 vaccine, including the influenza vaccine. And there's not this controversy over getting a vaccine like this. And we know that COVID-19 is a threat to the military and to the readiness of that force, and that it does protect against serious illness, hospitalization, and death, even if some of its ability to protect against infection has been denigrated by Omicron. I think it's interesting that there's this controversy over COVID-19 vaccines, but not the anthrax vaccine or the smallpox vaccine or chickenpox, all of the other vaccines that they're required to get, which are not real threats to the military the way COVID-19 is. COVID-19 is ubiquitous. And these other diseases are much better controlled, but yet they're required to be vaccinated.
But you may be absolutely right as a medical matter. I don't challenge you. You're an expert in this area on that medical assessment. But the reality is there is a controversy, right? It can be based on misinformation, whatever it's based on. It can be based on personal fears, can be based on what people's doctors may be telling them, rightly or wrong, whatever it is. There are a lot of people out there who don't want to get the COVID vaccine. And it seems to me that this is a public policy meets medicine meets politics decision where all of those things have to come into play. And it would seem to me that in that analysis, that we would say it's just not worth losing 11%, even though you disagree with their decision, no?
I think that's a decision that the president, the secretary of defense, the chairman of the Joint Chiefs have to make over what vaccines they want to require and what penalty there is for not following the recommended vaccination. So that's more of a public policy issue and not one where my subject matter expertise can really play that much of a role. I can say that a military that is more fully vaccinated is going to be a stronger military, everything else equal. And I'm worried about the fact that there are 11% of service members that don't want to be vaccinated, because I think that speaks to who's going into the military, and that there's vaccine hesitancy even amongst our military is something that really shows erosion in trust of these vaccines. The military was a place where Walter Reed served. It has all these giants of infectious disease, and it's just sad that the military, who are pioneers in
I gave for myself. When I get asked to show at a restaurant evidence that I am vaccinated, I am not convinced in any way, shape, or form with the explosion of Omicron, how contagious it is now, that the fact that someone next to me is vaccinated isn't going to prevent them from giving me the disease. It will help me if I get hospitalized. But the evidence is so slight at this point that the newest forms of Omicron are being prevented from being transmitted by the vaccine, that it does seem that there's a legitimate discussion to have about whether it's even worthwhile to require that, no?
In settings like restaurants, I completely agree with you that this transmission blocking is not occurring with the vaccines. But I don't think that's the rationale for the military requiring it as a condition of enrollment. What I think is happening there is they're trying to make their force more resilient to this infection so that people aren't getting sick, that they're not out on sick call, that they don't have to be quarantined, they don't have to be isolated. That's the issue. That doesn't apply to restaurants. It might apply to restaurant employees, where an employer may say, we don't want all of our cooks to be going off because they're getting COVID. That's the same rationale, that an employer may want to have a resilient workforce. And clearly being vaccinated is going to keep you resilient, because you're going to be, even if you get COVID, you're going to be less likely to be hospitalized, less likely to get long COVID, all of those cascading benefits.
But it's a cost-benefit analysis. And to me at this point, even though I've said I think I wish everyone was vaccinated in the military, the cost-benefit at this point to me suggests if they want to be unvaccinated, the 11%, I don't think the impact on others is significant enough. I think the problems with recruitment are so serious that we ought to just let them be. Your final thought on that?
Again, I think that's a policy discussion that subject matter expertise I can inform it, but that's something that the President, Secretary of Defense, those types of people, the Surgeon Generals of the services, they have to decide on where they want to draw the line, because again, they vaccinate against many other diseases that are less threatening than COVID-19 without any controversy. So I don't like the fact that COVID-19, which is a safe and effective vaccine, which we have tons of data on, is what's stigmatized here.
Yeah, well, look, I don't like it, but it's a reality. And I think we got to live with reality and make decisions accordingly. Doctor, thank you so much for coming on the show. Appreciate it.
Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your cable provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.